The Ministry of Health, Labor and Welfare is a cabinet-level ministry of the Japanese government. It is commonly known as Koro SHO in Japan. The ministry provides services on health, labor and welfare. It was formed with the merger of the former Ministry of Health and Welfare or Kosei SHO and the Ministry of Labor or Rodo SHO. The Minister of Health, Labor and Welfare is a member of the cabinet and is chosen by the Prime Minister, typically from among members of the Diet. The ministry contains the following sections as of 2019, after a fatal bus accident on April 29, 2012, where a bus bound for Tokyo Disneyland crashed in Gunma Prefecture, killing 7 and injuring 39 others. The ministry launched an investigation into highway bus companies. Investigations were carried out at a total of 339 businesses. It was discovered that 95.6% did not provide at least 1 day off a week, which the law obliges employers to give their drivers. Also, it found that 260 did not observe standards involving bus driver working hours, which prohibit them from working more than 16 hours a day in combined driving and office time. The ministry said it took corrective measures with those who violated the laws. Published ministry employee and outspoken critic Morio Komura states that the ministry's medical officers are corrupt and self-serving. Komura states that the officers, who number 250, have little experience and see no patients nor practice medicine after being hired by the ministry. Thus, says Komura, Japan's public health policies lag behind other developed countries by decades. There is a view that there is a considerable shortage in the welfare policy of the Japanese people, due to the practical limitation that the Ministry of Health, Labor and Welfare is specialized in the function of employment and labor rather than health and welfare. In many other countries, the department specialized in employment and labor and the department specialized in health and welfare are totally separated in functional formation, so the response can be relatively rapid in the case of a health crisis. But in Japan, there is a limitation that the response in the field of health and welfare is relatively slow. Coordinates: 35 degrees 40 minutes 23 seconds north, 139 degrees 45 minutes 11 seconds east, 35.673 degrees north, 139.753 degrees east, 35.673, 139.753.